Nathan and I kicked this idea around a couple of months back, and we had no idea that this was going to turn out as well as it has. So I just want to say thank you all for showing up to these Zoom side chats. I've really enjoyed this opportunity. It's a great excuse for me to get to talk to people that I find really fascinating. And then I love getting to share those experiences and those connections with all of you. I do want to say a special welcome to our guests from ETSU's Governor's School. This summer, they're working on some COVID-19 modeling projects. So we hope some things you see and learn about today are going to be useful for your research. And we've got a lot to discuss and some really cool people to meet. So we're going to go ahead and get started. So first of all, let me introduce Tim Kuhn with the Tennessee State Data Center. I've had the good fortune of working with Tim on several projects over the last couple of years, including stuff he had done previously with the Knox County Planning Office. And he's been a longtime supporter of GIS Day here at UTK. And Tim probably makes some of the best ArcGIS Online dashboards that I have ever seen. And I'm really looking forward to having the opportunity to share those with you today. And then the other great thing about what Tim does is Tim actually travels around the state. Well, he was traveling around the state giving training and workshops on how to use his data, how to use the dashboards. I'm sure at this point, all that stuff has transitioned to online, but we're really lucky to have him in the state to be such a good resource. And I think right now he's probably spending all of his time trying to get more Tennesseans to fill out their census form.
That's right. You have until October, but they'll start knocking on your door in mid-August.
And Tim, feel free, if you've got a link that you want to put where they can go to learn information, throw that in the chat and let folks know about it. We also have Dr. Andrew Joyner from ETSU's Geosciences group with us today. I've had the good fortune of working with Andrew for several years on a variety of different projects. We have collaborated and commiserated on building augmented reality sandboxes and hauling them all over the state. I got to go to the Ezra User Conference a couple years back with Andrew and his team and just had a wonderful experience there with them. And most recently, he's been supporting our efforts with our Megabytes Academy, which is focusing on teaching middle and high school science teachers about medical entomology and GIS. So I actually asked Andrew to come in and talk, kind of broadly about what is medical geography in that capacity. And finally, I can't say enough good things about my friend Liem Tran here at the University of Tennessee, Knoxville. I just want to highlight very briefly the fact that Liem does such an excellent job of using geography and geospatial technology to support Tennessee in a number of challenges, including the opioid epidemic, and most recently now with the coronavirus. And I think one of Liam's greatest strengths is he always builds these strong teams of experts from cross-discipline. And I think that really does just the most excellent job of showing that interdisciplinary nature of geography and geospatial technology and how bringing all these subject matter experts together really helps us solve problems. So really happy to have this crew with us today. Thank you all for taking time out of your afternoon to be here with us. So let's get started with the big picture. And Andrew, I'm gonna send this one to you first. And you know what I'm gonna do, Andrew? I'm gonna stop this share over here, and then I'm gonna pin you right here to the top so we can see your face.
All right.
So Andrew, we do have some folks joining us today who don't know a lot about medical geography, probably without much geography background in general. Can you kind of give us a short version of what is medical geography and how is it used?
Sure. I mean, in its simplest form, medical geography is kind of the intersection of space, time, and health. And so how do we kind of perceive and analyze health and spatial epidemiology and all of these kind of medical aspects from the perspective of a geographer, from someone who's looking at spatial components or temporal components, or how do things change over time? What's the environment like over time? And kind of my background with that, my master's degree was in medical geography from University of Florida. And during that time, I focused a lot on the spatial epidemiology of anthrax in Central Asia. And so I looked at where Bacillus anthracis, which is the bacteria that causes anthrax, exists in the environment. It's a really big issue in a lot of the former Soviet Union countries because they don't have widespread vaccination programs for cattle and other livestock. And so they would ingest that spore and then die pretty quickly through gastrointestinal anthrax. And so that's a big issue over there. But then it's also an issue because that can be weaponized. And so it actually was a DoD funded grant. And so it's kind of combining bioterrorism, medical geography, spatial epidemiology, and we also had a climate component. So we were looking at where do we see Bacillus anthracis now? Where could it be in the future? And so looking at changes in climate and those kind of climate change models to see where might we see expansion and contraction. The classic example of medical geography is John Snow with the cholera outbreak. There you go, perfect. Yeah. So there's so many great GIS labs and cartography labs now that use that data and kind of reconstruct that. It's a fantastic early example, one of the really first well-documented examples of medical geography and spatial epi. And so really looking at where are people getting sick? Does that location have does that location have an impact or a reason why people are getting sick? And it was that pump that people were contracting cholera from, or that was contaminated. And so that's kind of classic medical geography, which many people have heard of. So there's a long history of medical geography, and what we're looking at now with COVID and with the dashboards that we create, is classic medical geography, and it's ideal for geospatial analysis.
So let's take a look, since you brought it up.
Yeah.
So one of the things I was really impressed with, because I was looking through everybody's content today to get ready for today, and at first I was like, oh, this is really cool. I got some neat stuff in here. And then I kind of missed the fact that there are all these little arrows at the bottom. Man, you guys have put in, they just keep going, and you've got all these different resources that are in here. So tell us a little bit about your team there at ETSU. What was your motivation for putting this thing together?
Yeah, we started with a Tennessee one, and it definitely, I think Tim and I were probably building one at the same time without knowing it. And so we started with, I got a cat in here. There you go. So we started around the same time building a Tennessee one. And so we focused on that. We didn't see one at the state level, but of course we had been really closely following the Johns Hopkins efforts and the kind of the global map. And once we started to see cases pop up in Tennessee, we felt like we needed that, and we were able to see the data from the Tennessee Department of Health being released each day. And it was released at the county level. And so Tim can, of course, attest to this too. The way they've released data has changed over time and gotten better. And so we've been able to build more because of that. But it started actually with our county emergency management agency and with our ETSU emergency management specialist. Really, the idea was, let's think about where are our vulnerable populations, and can we track this in real daily so we can see, are we seeing a spike? Are we at the beginning of a surge? Are we about to have high hospitalization rates or resources compromised? And so it really started from an emergency management side. And, kind of my background with that is, of course, I'm also the director of the Geoinformatics and Disaster Science Lab, and we do a lot on kind of the mitigation side of things. And so we already have a really good relationship with our area emergency managers. And so it was a really good fit for that. And thinking about, where are our vulnerable populations, and how do we produce some kind of product that could help them as far as planning goes. So it really started out with that, with Tennessee, and then it kind of evolved to that bottom dashboard, the Central Blue Ridge. That was developed several weeks, close to a month later, about 3 or 4 weeks later. And we wanted to, our area here in Northeast Tennessee economically is very tied to Southwest Virginia and to Western North Carolina. And so we felt like we were missing a part of the picture as far as our region goes without including data from those areas. And so we had a few different iterations of the footprint, and we settled on these counties, which are in general about 90 miles from Johnson City in the Tri-Cities area. And that's actually been really interesting. We've seen very different realities in each of the 3 states. And so that's actually been one of the most interesting things to take a look at, is what's going on in Western North Carolina. There's a meat processing plant that had a huge outbreak that if we were just looking in Tennessee, we wouldn't have known about. A number of nursing home issues over there, and a lot of issues in Southwest Virginia around Galax and Grayson and Carroll counties that we really wouldn't have been aware of if we weren't using this type of dashboard to track that.
Yeah, I feel like that's an important concept, especially as geographers, to think about, because we always, when we think about enumeration units, we think about counties and states and that sort of thing. And this is almost more like one of those sort of the metropolitan statistical areas or something, is really more what this is kind of mimicking.
Right.
Yeah, very nice. Thank you, Andrew. This is great stuff. And for anybody that wants to follow along, as I pull each tool and website up, I'm putting the links to those in the chat. So if you want to follow along, you're welcome to do that. So Tim, let's go to you next, because Andrew's already kind of alluded to the fact that you are taking care of a lot of this, this data. So tell us a little bit about the data you're working with. Where's it coming from? How is it being updated? Who's using it? That sort of stuff.
Sure. Yeah. Thanks. The dashboard that we created, first off, is entirely reliant upon the data that the Tennessee Department of Health is publishing, with the exception of a few pieces that we're starting to weave in, with the nowcast being added, which is from Dr. Nagel there in the UT geography, and we're about to work in some transmission rate information from Dr. Tran, But by and large, other than those two pieces, we're in some population things. We're getting all this from the Tennessee Department of Health. It started out really as me just kind of logging it as in Excel as a person who likes to watch this kind of information, who had been watching the Johns Hopkins information as well, and just scraping that every day and starting to pull that into a dashboard, and just basically through Excel, but then using the information that I was pulling down to calculate some things like some rates of change from day to day, really kind of starting to build out a set of statistics about the state and publish that data along with the dashboard. And a key thing for me is as the dashboard first went out was that this information, that the open data aspect be integrated into the dashboard from the get-go. It wasn't kind of an afterthought or a follow along. It was really intended to be kind of part and parcel with the dashboard. That is, and since that repository has come out, there was, I should mention, there was a point in time too when the state switched to from the kind of the HTML based information that was going up onto the page to a PDF. And it was kind of like, just kind of blew everything up for a few days, where we kind of had to stop and figure out how we're going to do this. And Suzanne White at STS GIS really came to our rescue on at least 50 occasions. I mean, so she's been really helpful in terms of getting us. At one point, she just happened to have a version of Adobe Acrobat that could scrape the PDF better than anybody else. And so, she was able to work with us, and I think to some extent, STS Group helped advocate for getting the downloadable information that's now being provided by the Department of Health on their website. And so part of my afternoon now at this point every day is going there, no longer having to scrape HTML or PDFs, but being able to go there and download a set of data that is basically built off of what we initially started with. And then we now use that to publish our information. So kudos to both to the Department of Health and to STS for making that change. And I mean, I have to say, when we look at the information that we have now in Tennessee versus other parts of the country, I think we've got everything that anyone would want. That's not going to identify patients on an individual basis. I don't know what more we'd want to put out there, but there's always been more information go out as this has gone on. It's never been less. Nothing's been taken away. It's always just kind of been expanded more and more.
So I'm looking here at what I think, Tim, is the data that's feeding your dashboard. Is that right?
Yeah. So you're not seeing all of it. Some of that's kind of the basic data that is that is feeding the dashboard. That's data that you can go download. There's some other map services and tables behind there that you're not seeing. But as far as, that's been one of the learning experiences that's gone on in running this. Normally with the other dashboards we put together, they're one-offs where the data is not updated, or maybe they're updated monthly. This is a daily task to do this. And so part of it has been learning about the tool. What initially was just copying some rows in and uploading Excel has become a lot more involved with time as the amount of data grows. And so now we're running, just overhauled all my geoprocessing tools last week to try to get it down to a one button click, and did that. But this become a big part of this is, how do you keep this information up to date and refreshed on a daily basis? It's become a combination of different tools to make it happen, but it's a better part of an afternoon, and even weekdays and weekends, to do that.
All right. Well, I think you've hit on something that we need to continue to discuss at the state level, which is sort of how we provide open data at the state level, because obviously I just looked at some of the numbers on this, and there are thousands of downloads on some of this data that you're using, and that doesn't count all the active hits you're getting. But let me ask you this, Tim. So on this data, are you mandated to share this and build this, or is this something you just decided you wanted to do?
No, for me, I think it was right around the time when, Tom Hanks got infected, and all these things kind of started hitting home around mid-March. And having worked with other dashboards, worked with ArcGIS operations dashboard, and seeing what Johns Hopkins had put out, it was like realizing all along, this is not any different than what we were already doing. We can do this. And that Hopkins dashboard hit really mainstream. And everyone is seeing it, and everyone is using it. And so I got a kid trying to walk in the door. So that was really part of it. It was just like it was therapeutic in some ways to be able to work on something to try to help push information out about Tennessee and provide data for other people to use, whether it was in media or academic or government uses. But especially for the public, to have a spot for them where they could see trend, just to see the change over time, because that wasn't something that was being provided. And so that aspect I thought was pretty important, that we'd be able to do that.
Tim, as usual, I mean, these dashboards you build are just awesome. I hope anytime other Tennessee folks have a chance to take one of your workshops, I hope they get a chance to do it. And I might have to talk you into come being a guest for my 311 class, because I think I've decided we're going to work a dashboard into one of our labs. All right, bear with me for just a second, because I've got to move where the hide floating meeting controls. There we go. Liam, let's switch over and let's talk. We've sort of got a background on the medical geography side. We've got a little bit of background on the data and where it comes from. So let's talk a little bit about the modeling and the work that you're doing.
With the spread of the pandemic across the whole globe, so there's a global effort to put the data together. Now, some big data sets made available by some big institutions like Johns Hopkins, the New York Times, and on the COVID-19 data, on the confirmed cases, on the number of deaths, etc. And along with that, also some other big data set like the social distancing, like the Safecraft company, they make the data on the mobile phone, leaving the house, and available to all researchers for free. So it's you have a wealth of data, and put that in the context of Tennessee and in terms of modeling. So in terms of the modeling for COVID-19, there are different approaches, like a statistical approach, like you might already see the nowcast model developed by Dr. Nagel, and other approach like analytical approach or the system dynamic approach. And at UTK, there's I would say quite a big group of modelers and analysts work together. Like from the math department, from biology, microbiology, even engineering, school of nursing, public health, etc. But to keep it short, I would say that the geography can bring to the table a very distinctive component, that the spatial dimension, into the modeling, into the analysis of the COVID-19 spread over time and space. What I mean by that, for example, space. So keep it simple, because our audience today is undergrad, right? So space, like with geography, you often do the overlay. And one of the example that I overlay the spread of COVID-19 to I call that the vulnerability assessment. So overlay how the outbreak spread over time, and the result available at those places like hospital, and the socio-economic condition to derive the so-called vulnerability to COVID-19 in Tennessee. And this is just an example, but right now I have the material to put into the manuscript. So actually I'm working on that manuscript today. And also talking about bringing the spatial dimension into modeling, I would say that the geographers surprised other modeler a little bit, because when I work with those modelers from the math department, they often have a model that doesn't have the space in there at all. And when I discuss how to take into account the influence of different units on the map, and in a very geographic way, so they really appreciate what we bring to the table. And also and in geography, we have the opportunity to blend things together. Like I just mentioned with Dr. Nagel's example, Dr. Nagel used the statistical approach, and what you see right now behind the scene is AP model, epidemiological model, and behind the scene, allow me to mention a little bit about the term. It's called the SIR, susceptible, infected, and recover model. And one more component is called SEIR, susceptible, exposed, infected, and recover. And that model basically it's a bunch of differential equations, but it's solved using the observed data based on active case. And this one, in a nutshell, it shows you the transmission rate or the reproduction number. So if that number is able to maintain at 1 or below 1, so that means we able to control the pandemic. But if that number above 1 and the higher, that means the pandemic spread, I would say widely in that area, because it's go with the exponential growth, etc. So I have that kind of model running daily, and feed the data to, and now team is able to put that on the dashboard. I hope the new dashboard will come out soon, right? Yeah. So I keep it short that way. So with all kinds of data, you're able to plan the different way, and geography able to bring in the spatial dimension in the modeling, in the analysis, in a very unique way.
So Liam, you said you're updating this every day. Are you having to take the Tim approach, and are you having to go in and manually update things, or are you able to like pull in Tim's services, or are you getting your data from somewhere else?
From Tim.
We're all relying on Tim.
I can set up to run that automatically, but sometimes some data problems. So sometimes the team have the data available by 4 p.m. But sometimes I check 9 p.m. is still not there yet, so I wait until the next morning.
I love it, Liam. This is great. So I've got 3 different resources that I think I've posted there for y'all to look at. So one is just the social vulnerability index map that's got a bunch of the data in it. We've got the estimated reproduction number map for Tennessee. And then we also have Liem's story map that kind of explains the process on how all these different variables are put together, how they all work together. He breaks it all out like layer by layer. So if you're kind of looking at, you know, how do you build one of these things? Because honestly, like if I look at that, that's a little overwhelming and terrifying. But if you break it all out into those smaller components, it's a lot easier for me to understand. So let me take a break real quick.
Allow me to say a bit more that I'm collaborate with people in the Core 19 group, and right now we have an effort to do some modeling for our campus UTK. For example, if to do some scenario analysis, so we have some agent-based modeling combined with the systemic model to say if we have something going on in the dorm or in the classroom, so how that kinds of thing might spread across the campus, and how would we address that situation? Okay, I stop here.
All right. No, this is wonderful. I love hanging out with all of you really smart, motivated people, because I get to learn all these things, and this is just so much fun for me. So let me pause, and I'm going to keep an eye on the chat, and I'm going to keep an eye on the participants window. And if you have questions, go ahead and let's hear them for a minute. And you can feel free to just unmute yourself at this point.
Okay, hey again. So I have I guess, broader question of all of the work that you guys have been doing with COVID-19 relating to the state with these dashboards and other things. And I apologize if I missed this. Are you also additionally working to a certain extent in like any advisory roles with, say, ETSU or UT, or even, you know, the state and things like that, more directly on a daily or weekly basis to chart out what the long-term response is going to be?
So let's start with Andrew, because Andrew's intimately involved with the emergency management space there at ETSU.
Yeah, so we've definitely worked, we work directly with the emergency manager at ETSU and the Washington County emergency manager. We've also coordinated directly with the College of Public Health and with the Northeast Regional Health Department. So that's our regional health office. And so all of it kind of together, you know, our dashboard and tracking kind of mechanism is one piece of their puzzle. And so it's certainly contributed to some of the decision making there. It's helped them maybe see some disparities that it didn't see before, but it's certainly informed some of their perspectives on what to do next. One of the other things kind of separate, let me share my screen really quick here. Can you guys see that?
Yep.
Let me go to here. So this is, we also developed, this is not something I think I sent a link to, I don't know if Michael, if you've seen this or not, but we've also worked with the county and regional economic development group and I guess it's the Economic Recovery Task Force is what they call themselves. And so they wanted to think about how do we easily get restaurants and businesses on board with following the Tennessee pledge of reopening responsibly. And so this is another area that we've worked directly kind of with, and public health office is also involved in this. And so all of these are examples of either retail or restaurants or other that have agreed to follow that pledge and, you know, practice social distancing, wear a mask, all of those things that are part of the Tennessee pledge. And so, you know, very common, easy to use web mapping application here that has information that is actually filled out through a form. And so let me go over here. Let me go. So this is the form here. So all of the area businesses were sent this kind of survey, 1, 2, 3, easy to build form, and it automatically populates, you know, into the map. So there's really, like, once I built the map, there was nothing to do, which is not the same for the dashboard. You know, the dashboard takes time each day to update. But all that information was there. If they click here, it links to that survey 1, 2, 3. So it's a really nice tool. It's just one of the many things that we kind of did as we went through this and tried to connect with our community. So there's a lot that I think our community's been able to use from this, even moving towards the economic side.
Yeah, I think, you know, I sit here and I'm always concerned about the health side, you know, especially thinking about students coming back to campus and all that. But obviously the economic side is so important as well. Tim, are there any other ways that you're helping at the state level? Because I heard you say that you're getting support from the state. Is there anything else that you're able to provide back to them?
We're doing, well, on the economic side, in our work through the Boyd Center for Business and Economic Research, we provide some information to the state on a fairly regular basis. Those are on the Boyd Center website. We may have a link to those on our website. I'll throw it in the chat. But we're putting together just a weekly set of kind of key economic indicators related to unemployment, jobs, locals, tax revenues, and how those are changing, and new unemployment claims on a regional basis across the state. You know, all those things beg to have the same treatment, really. They beg to be put into a dashboard and have these events be tracked over time. And you know, it's probably where we need to find some time to carve out and focus in that area as well. We're trying to push a second round of updates on this dashboard that incorporates some information that Dr. Tran has compiled out. We've got the information compiled. I've got the information from Dr. Nagel in there now. We've gotten some feedback from some people about some things that we were missing or maybe shouldn't have included from an epidemiological perspective. And so we've made those changes. We've taken some things out. We're trying to replace it with some new information like positivity rates on testing. We were told that that's a pretty important thing. So we're not really providing direct support to the state as it relates to COVID-19. We're providing, as we always do through our Boyd Center work, just kind of advisory sorts of roles related to the economy.
Yeah, Tim, make sure you put a link to those resources there in the chat for us, please. Liem, is there anything else you wanted to address that Andrew or Tim haven't talked about in terms of how your role in this is not just taking the data and modeling, but how you're supporting these other agencies that need this data?
Yep, I'm in the Core 19 group at UT, and that group have met by quickly to give, and that group, the role is to give interact with decision makers at the state and county level to advise them on things going on related to the pandemic. Myself, I like Dr. Nagel, I have some direct contact with like the mayor of Knoxville, and we have chat and we have email exchange to brief her on the situation. Yeah.
Oh, this is awesome. I love, these are like GIS hero stories. These are wonderful. So if we don't have any other questions, I've got one question each, but I want to make sure everybody else that wanted to ask a question gets a chance.
I had a quick question. So I'm from Memphis, and you know, my father works in the hospitals as part of the administrative role, and he's been saying that recently in some of the local hospitals, there's been a huge spike in coronavirus cases in the past week. And you know, I've been looking at the news personally. I've seen in like New York, they reported 0 deaths for the first time this past week. Why in Memphis and in other, you know, communities around Tennessee have there been such a huge spike in coronavirus cases? And is there anything in the data that's like, you know, pointing to any explanations?
All right, who wants it?
I don't know if I'm going to be able to answer the question, but as I was looking at this data over time, it seems like there's this popular narrative that coronavirus cases maybe went away or they declined or went down. I'm not sure that that's true. I'm not sure that in Tennessee that it ever really went away. I think it's actually, if you look at the Nowcast data that we have that Nicholas has put together, it kind of shows that over time, it may be at its highest point ever in terms of the number of new cases that we're seeing. So, and then I may throw, we've got a new version of dashboard. I keep saying this, I may throw that in the link up in the chat, but hospitalizations is something that is provided from the state at a county level. And in order really for that to be useful, we need to really aggregate that up for places like Memphis, they're drawing from all over that region. And the same is true across East Tennessee. So we really need to provide a tool to aggregate that up at a more of a regional level. And so that will be part of the next version that we don't have it weaved in yet, but that will be part of the next version, is to be able to look at that, like maybe on more like a metropolitan level area. What is the rate of hospitalizations and how is that changing? I don't know what's driving the spike that we're seeing in Hamilton County. Sevier County had one yesterday, fairly large. There's been a steady rise, but I think it's kind of a continue of the inundation.
Andrew, is there
I'll
anything?
kind of add to that. Oh, sorry, Michael. Go ahead.
I was about to say, Andrew, is there anything you want to add?
Yeah, sure. I'll add to that. I think Tim's right that it's hard to kind of pinpoint one single thing. I know in certain counties, certainly in East Tennessee, we've had a number of kind of these migrant farm worker outbreaks where you got this congregate setting where they're a large population living together, working together. And that's where we've seen like Rhea County, up here in Unicoi County, we had 2 different farms, a tomato farm and a strawberry farm that we saw our areas, our region's largest outbreaks from. And those are very vulnerable populations too. That oftentimes their accessibility to healthcare services is lower, and just in general, they just have lower access to better living conditions. And so that's a concern for me. Certainly some counties are seeing large outbreaks in the prison population, Bledsoe, Trousdale, and Lake counties, and even up here in Johnson County to some extent, or some of the biggest outbreaks. For your large cities, I mean, you probably just have a lot of widespread community spread. I think that's what's going on in Sevier County, certainly where Gatlinburg is at. You have kind of this reopening and massive amount of tourists going into the area. I mean, it seems as busy as ever based on what I've seen and pictures of, with very little mask wearing. I haven't seen any mask in any pictures I've seen, and no social distancing. And so we, of course, did just have Memorial Day a few weeks ago, and so that was a big get-together time. So we may be seeing some of the results of that. It's just a variety of things, and I think Tim's right. I never really saw a decline. There seemed to be an increase and maybe a peak, and then it kind of maybe stayed steady for a little while. And then once we really started to act like everything's over and everything's fine, really seems like the last couple of weeks it started to take off again. Just because of maybe lack of awareness, or I'm not really sure. People are just ready to get out of the house and do what they're used to doing. And so I think that's a big reason there too. Probably in Shelby County, it's a variety of those types of things.
Allow me to add one thing. There's several factors, but one thing that I see clearly that the association between social distancing and the number of confirmed case. Talking about social distancing, there's different things like whether people stay home or when you go outside, you practice wear face mask or not. And the data I have right now, and also Dr. Nagel have that the so-called percentage of mobile phone leaving the house, and I see an increase in late May and now get into June. It's increased, not get back to the normal the level of February, but very much getting there. And I see an increase in the number of cases.
And I think that even leads us to a really fascinating discussion on the ethics of location privacy and the potential positive uses for that data, as we're seeing now, for helping make health decisions. But then also, we all know that there are times when that data gets misused. Tim, what else did you want to add? It looked like you were about to say something.
The only thing I was going to add is kind of something that Andrew mentioned, is just like kind of the intimate knowledge of all of the ways that you have to have about how these things happen and how they're spread. Maybe it's a workplace, maybe it's community, maybe it's in a nursing home or a jail, and there's large spikes that are associated with these things. And it's just like, that's the only data that we really get from the state at this point about that, as far as I know, is information about nursing homes, and that information is provided on the state's website. You can kind of guess by looking at some of the case data what's going on with a jail or a prison outbreak. But when it's maybe a single workplace or some place where the workers, migrant workers, whatever it is, this aggregation of this kind of information would be something that would be really useful and really helpful to help give people understanding of what's really leading to spread in their community, and whether it's a family cluster or something else. I think that's the one bit of information that me as a citizen would like to know a little bit more about.
And then of course we run in sort of almost like the HIPAA issues about how much information can you share, and then how much do you have to withhold so that you can't de-anonymize the data. Oh man, I'm glad I don't have to make these difficult choices and decisions. Everybody, it is 4:15, which is when we had planned to stop, and I want to be respectful of everybody's time. I'd like to ask my three panelists for just a moment. Let's take the Julius Caesar approach, a thumbs up or thumbs down. Do you think that based on the public's response, the media's response to these dashboards, these web platforms, these interactive maps, is this something you think people are going to expect going forward?
I think so.
All right, that looks like 3 thumbs up. Are you looking forward to that? Like, is that good for us? Is it good for you that we're doing those things?
I think it's good. I think that, we need to, as GIS instructors too, make sure that we're training our students so that they can take over these products and build their own, and really kind of empower them to do that. And that's certainly, I think you mentioned building dashboards in your next class, Michael, and that's certainly what I plan on doing. I've done a little bit sprinkled into my advanced GIS class, but we're going to be teaching a web and mobile mapping class in the coming year, and this is going to be a big part of that. And so I think that I think it's awesome. I know that's somewhat related to one of the questions you mentioned in one of our emails, like do we think that they're going to expect us for maybe the flu or the common flu or from other things? And I don't see why not. I wish I had this type of information or dashboard during flu season or doing some other, maybe seemingly more trivial type health issues. I think it's fascinating. I love it. And it does take a lot of time, and so we've got to maybe make sure we have the capacity to do that. But I wouldn't fault the count. I would actually be upset if the general public didn't want to see more of this, going into the future. I feel like this is something that, at least we do a Facebook post every day saying that we have this update, and we've gotten a lot of engagement, from that. I think it also, some of the engagement we've gotten also points to the lack of geography education. I think Kurt Budafish is on here somewhere. The lack of geography education in any part of education, K through 12 especially. A lot of people will ask me, where's Knox County? Where's Hamilton County? Where do I live? I'm like, okay, I'll do a screen cap. This is where it's at. From a geographer's perspective, you're really upset. You're like, man, come on. But it's so true. And even, I do a little bit kind of on the climatology side as well, and work with the National Weather Service in Morristown. One of the biggest things for meteorologists is people have no idea they're in a tornado warning. They don't know where they are on the map. And that's a really crucial thing too. So I feel like if we build more tools like this that are easy to use, easy to play around with, more people are using them, more people are understanding the geography and their environment better. And so I think there's even a bigger goal here as far as the education side, that it really is a golden opportunity for us to grab hold of. So I hope we do that. I think it's a big opportunity.
I think there's to me, there's a compelling reason for those of us who are engaged in geography and geospatial outreach. I actually think we maybe should follow up separately on a way to brainstorm on ways that we do, like what you're talking about. How do we engage and promote geography and geospatial technology across the state and across the region, leveraging the great work that's being done, the resources that are being put together. All right, it is 4:19 here Eastern time, so we're gonna wrap this thing up. So I just want to say, Tim, Liam, Andrew, we are so lucky to have you all in the state doing the work that you're doing. You know, none of you asked to do all this extra work and put in the extra hours and the loss of sleep that some of you have gotten. So thank you all so much. And thank you all for sharing your expertise and your knowledge with us here today. If anyone wants to stick around, I will leave the Zoom session open as long as you'd like to stick around. And if our guests and panelists have the time, you all are welcome to stick around. But I also understand it's past time and everybody has a life and you got family and stuff you need to get to. So thank you all so much for joining us, and everybody have a wonderful rest of your day and stay safe.
Thank you very much, Michael. That's an excellent section. Yeah. You did a
Michael,
great job.
I have a question.
Yes.
Does any of these models have a threshold that if the number of cases get crossed or whatever the parameter get crossed, that you go into a higher level of alert, or make the suggestion that something's not working?
Almost like a trigger point, and if we reach that point, some new action or activity gets that's activated. And I don't
Right.
have a clue. That's going to have to be a toss up to the panelists because I don't know.
Were we talking about this, Andrew?
Yeah,
Yeah.
I don't necessarily have one, but I think we should.
Everyone has kind of a different one, I think. You know, Knox
Yeah.
County does it different than Shelby County versus Davidson County, and so that's a very local decision. I don't know that it's 100% always driven by data.